The CDC issued new guidance last week recommending that fully vaccinated students, teachers, and staff do not have to wear masks during the upcoming school year. But families across the country are still confused about what this means for those kids who are not vaccinated or for states where COVID cases are on the rise. Take a look.
We have a lot of teenagers that are not vaccinated, and if we're saying that they're basically getting to choose whether or not they're going to wear their mask, like, how is that going to affect us? Like, what is the plan for if our rates become high again? Like, we don't want to shut down.
I just think we need to go back to normal. I think we got the most of it under control and the cases are down. I say let the kids not wear masks. I don't like them, and I don't like that my kids have to wear them either.
Not having the mask in the Delta variant, it is alarming because even though we're all vaccinated, I still have one child that is not. And that's even more alarming because then that puts him at risk.
I'm just trusting that the Scranton School District will do right, make the right decisions. If the children are vaccinated, maybe they can keep the mask off.
At the end of the day, it's just like, what are we going to do? Like, how are we going to wear masks for the rest of our lives?
I don't know how they're going to monitor that. I don't know how they're going to maintain that level of understanding of who's gotten a vaccination, when was your 2 weeks from your last shot.
A lot of questions there about those new guidelines. So how should we be preparing for the upcoming school year? Let's go to the president of the American Federation of Teachers, Randy Weingarten, and ABC News medical contributor and chief innovation officer at Boston Children's Hospital, Dr. John Brownstein, for more on this. Thank you both for being here.
Thank you.
Thanks so much.
Dr. Brownstein, let's start with you. This new guidance says that fully vaccinated students, teachers, and staff don't have to wear masks in school. But what about those who aren't vaccinated yet? And how is the school going to determine the difference?
Yeah, I know there's a lot of conversations happening about these new CDC guidance, and it makes sense. But remember, CDC is placing a priority on in-person learning first and foremost. And yes, they are recommending masking for those who are unvaccinated, especially, of course, those that are under 12 who can't receive the vaccine yet. But really, the CDC is making a nuanced sort of guidance that allows decisions to really happen at the local level. We have huge amount of variation in terms of community transmission, level of vaccination, local outbreaks. And so it allows for more interpretation at the local level. The decisions about how we're going to track vaccinated versus who isn't, that's really going to be done by public health. And of course, parents also have flexibility to determine masking for their kids. And we also have to remember, we have flu outbreaks every year. Kids die from flu, and yet, we don't encourage masking. So CDC is trying to line up guidance that looks a little bit more similar to sort of annual respiratory illnesses. And I think that's what we're starting to near, as long as we can keep this pandemic under control.
So, Randy, the CDC also left a lot of the decision making, as we just mentioned, up to the local officials, urging them to consider community transmission rates. So you've come out in support of the guidelines and have made it very clear that your goal is to get students, teachers, and staff back in the classroom full time. I'm also for that as well as a mom. So how are you trying to ensure that that happens this fall?
So first, and Dr. Brownstein is quite right, we hopefully are seeing COVID in our rear view mirror. And the more people get vaccines, the more likely that is. You're seeing, for example, that the variant rates, the Delta rates, are really going up in places where there's low vaccination rates. So I think that the CDC did 4 things that were really important. One, they said that in-person learning is really important, and we should do whatever we can to get back in person, all of us, this fall. We completely agree with that. And we said in May, we thought that that was important. Number 2, vaccines have been the game changer. And we're seeing that in terms of our membership. 9 out of 10 educators have gotten vaccines. And we're seeing it's just a huge sea change in terms of people, the lack of sickness and the lack of illness. Number 3, because you have still a whole cohort of people, kids, as well as people for whom vaccines are not appropriate, then the CDC is saying masks and the other layered mitigation, including ventilation and 3 feet of physical distancing. You can still group desks together, but you do that. So I think they're trying to be wise about the variation around the country. And I think they're trying to actually make sure that we can be safe and get back to school. These are a floor, not a ceiling. So that's why in California, in Hawaii, you're seeing those states saying everybody should be masked. Now, I'm an asthmatic. I really hate wearing this mask. I have to do it because it's protecting others. When I'm with when there's places that say you have to wear masks, but ultimately what we're trying to do is make sure that we're keeping kids safe, keeping educators safe, keeping communities safe, and being back into school.
And Dr. Brownstein, how big of a challenge is the Delta variant posing to all of this within the realm of the upcoming school year? Is that a big concern for parents and school officials right now, or do you think the guidelines will hold regardless?
Yeah, I think overall Delta is a real concern. I think Randy, spoke really well about this. It's really all about the vaccines. The vaccines we know really perform well against the Delta variant, but in a place with low vaccination, that's a real problem. What the CDC got right is that it's not a one-size-fits-all recommendation, and it's all about layered protection, masking, ventilation, thinking about distancing and testing, and really it's going to be about the states. And depending on their local context, that is the kind of the decisions that are going to be made. So for instance, in Vermont, where you have really high vaccination rates and case counts are low, you're going to be able to move forward with relatively few layers. But on the other hand, areas that are experiencing high cases and low vaccination rates, states like Missouri, then you're going to have to take more intense action if you're going to want to keep these kids in school, unfortunately.
Randy, how closely are you watching developments on the Delta variant? And could it change your current stance of advocating that teachers and students return to the classroom full time?
There is nothing that we see right now that would change our stance in terms of going back to school in the fall full time. The real issue is, will we have in those places, like Dr. Brownstein said, in those places that have low vaccination rate, will it hurt the entire community? Will you start seeing more hospitalizations? Will you see, God forbid, breakthrough disease? The real issue becomes, can we get to herd immunity as quickly as possible? Can we make this about public health, not about politics? The educators around the country want to be back in school. They know that is more effective for children than you see behind me. I'm at the National Teachers Hall of Fame, and we are honoring educators today. But this is about helping our children thrive. So it is patriotic to have a vaccine. We think that the vaccines, or the evidence is suggesting that the vaccines work against the Delta. So ultimately, that is our best way of moving forward. And with the layered mitigation, including where kids are not vaccinated, masks, ventilation, and ultimately we'll probably have to have a bunch of testing. I hope we don't have a situation where we're going to see something of COVID of coming back and some variant coming back that we don't know of yet. I hope we get to a situation, like the good doctor said, where this is like a respiratory issue, like a flu and like other respiratory issues, but that we have really taken on, confronted, and beaten COVID. That means when you can, get a vaccine.
And Dr. Brownstein, when can we expect kids under 12 to be eligible to be vaccinated? And then, Randy, my follow to you is, how much will the union be pushing for those kids to get vaccinated once they are authorized? Dr. Brownstein, you can start us off.
Yeah, sure. I mean, listen, I think this is on everyone's mind. I mean, I have a 10 and 11-year-old. I want to get them vaccinated. The studies are well underway. There's 4,500 children in these clinical trial sites, 90 of them across the globe. They're studying, of course, for side effects and safety primarily, but also to make sure these kids mount an effective antibody response. I think we'll know by September where these vaccines are effective. Likely, we're going to see similar data to the older kids, and these vaccines will be approved for emergency use. And so, thinking about September timeframe for the 5 to 11-year-olds, and then shortly after that for the younger kids.
So Randy, once that happens, are we going to hear from the unions that they want to see kids vaccinated in order to keep schools open, or anything along those lines, or is that going to be left up to the parents?
Look, first and foremost, it is a parental decision more than a teacher decision. But second, if the vaccines are safe, and I'm glad they're spending the time to assess that, not rushing it. If the vaccines are safe, just like a measles vaccine, just like a polio vaccine, we need kids to have the vaccines because it will help keep them safe and keep others safe. But at the end of the day, this is a parental decision. And right now, given the polarization in the country, we are about persuasion and about doing this voluntarily as opposed to any other way.
All right, Wendy Weingarten, Dr. John Brownstein, we appreciate your time today. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.